This session is on problems with the machine, troubleshooting to figure out what's happening in the machine. The first place you always want to look with the machine with any problem is to make sure that the left side of the machine is developing the proper pressure, vacuum, and the proper airflow transport. That all happens right in this left side of the machine. The waste canister is the source for all of the airflow and all of the vacuum. The motor pulls the waste canister down to as much vacuum as it can. If there's no leaks anywhere between the waste canister and the motor, this side of the machine will be perfect. If there's any leaks at the waste canister or the secondary filter, then we can never have enough airflow and pressure to produce crystal flow to do the abrasion at the handset. The right side of the machine is all airflow and crystal. The left side of the machine is the vacuum and airflow development that creates what happens on the right side of the machine, and it all comes together in the cap on the handset. Okay? So the first thing, no matter what the problem is, check the left side of the machine exactly the way I'm going to show you right now. Set the aspiration, the mode valve in aspiration, the mode switch in crystal, turn the pressure to maximum where it says maximum, and occlude the handset with your finger or your thumb. And this tells us the primary vacuum of the machine.
Which is 21.
21 to 22 inches of vacuum. Okay? That is a good number for this machine, the Bella Micro. The next thing we want to check is airflow, and you can hear the air whistling into this handset, and that airflow tells us how clean this side of the machine is. This machine, any machine, can be very dirty and still develop a vacuum. The airflow is what creates the work on the right side of the machine. So this airflow must be correct. And we're seeing a 4 on the gauge, and that is a correct airflow for this machine with maximum pressure. So now we'll turn over to crystal mode, crystal on the mode switch, crystal on the mode valve, and now we will check what's happening on this side of the machine. We know that this side is okay, and so now we will merely occlude the handset, and this tells us, and if you look into the crystal jar, you'll see the boiling of crystals, and that means that we're sucking air through this side of the machine. And we've got 14 on the gauge, which tells me that the accelerator in this machine is worn just a little bit, but it's not the slightest bit hurt yet. Okay, if it was down around a 9 or a 10, then the accelerator would be worn out beyond efficiency.
And it would be time to change it.
And it would be time to change it. But right now, it's good. And we've got good airflow, which means that we should have good crystal pickup. Now, to test the crystal pickup, there's several ways we can do it. I just put it on my thumb for 5 seconds. Mississippi 1, Mississippi 2, Mississippi 3, Mississippi 4, Mississippi 5, and I look for a clean white dot. Okay? And there it is. And that is missing skin. It's not anything else but missing skin. And so that tells me I've got a real good abrasion going on. Now, that's normally the way the machine will always work. But let's say you're using the machine and the person you're working on says, I do not feel the crystals on my skin. I don't feel the sting of the crystals. that means that we better check and see if we're getting good abrasion. And you can do that with just by abrading on your finger for 5 seconds at a high pressure and see if you get an abrasion. If you do, you better check the person, because you don't have enough pressure to give them a good treatment. Always check on your fingers with maximum pressure. When you're going to do a treatment, you want to set this pressure down somewhere between a 3 and a 6. Very few people can stand more than a 6 on their body because it's painful. These crystals smacking into your skin is not fun. It's a very stingy situation.
Now, well, what is the highest level you should ever do a person on?
It depends on the person and where you're doing it on their body. You can abrade every portion of your body. If you're abrading somebody's neck, pretty tender around the neck, you probably never go more than a 3. If you're abrading on somebody's hand, the heel of their hand, here's a 5, it doesn't hurt. Well, on the heel of your hand, you can probably abrade it clear up around a 15, and it still doesn't hurt because there's very little pain sensors in your hand and it's very tough skin. So to try to say what the pressure is you should put is strictly up to the person. Every person has their own skin and their own sensitivity to pain.
And that's why we should always test it on the inner side of their arm.
Exactly, exactly.
And
so,
always keep the handset moving.
Put it on them and go back and forth. This is a 3.5, and I can feel the sting. I'll turn it up to a 5. Big sting. Turn it up to a 7. Yowie! Too bad, too bad. Okay? So it's up to the person and their own skin. You must always test every person that you do an abrasion on to make sure what their sensitivity pressure is. If you abrade somebody to where it's too painful, they're going to be so hot and so inflamed on their tissue that they won't be coming back for a while until they forget all about how bad it hurt.
And we also want informed consent forms signed by the patient, and as well as taking a history of that patient to see if they're taking blood thinners or any other type of a chemical.
Or if they're diabetic, or if they have lupus or anything else
that might compromise.
That's right. Compromise their immune system, because this machine is an assault on the immune system of the body. This is not something that's silly and funny. It's taking your skin off. Nature puts this horny layer of tissue to protect you from the environment. This machine takes that horny layer of tissue off. Nature does not want that to happen. It makes you look better. Nature don't care how you look. Nature wants you to be safe. Okay? All right, let's do something that creates a little problem for this machine. Okay? If we have a crystal stoppage up in this jar to where we're not getting any crystal flow, now we have to find that problem. Okay? And to find that problem, we would set this up to maximum. We would be in crystal mode, and the first thing we'd do is look and see if we get air in the jar. We include the handset and the air pops.
Yes, I see the crystals fountaining.
Every time I close the handset, the air starts flowing. That means that we are in fact creating an airflow on this side of the machine, and that means that the venturi pipe is setting up a suction. If we don't get crystals into the airstream through the venturi pipe, then the orifice in the venturi pipe must be occluded with something, which tells you that there's some foreign object in that crystal jar that's stopping that orifice.
Okay, so if the crystals are dancing, we'll call it, that means that we have airflow. But it does not mean that the crystals are going into the venturi tube.
That's right. So the first thing you want to do is grab the jar. If there was something in the jar that was occluding that orifice where the crystals get pulled up into the airstream, we'll stir the crystals up. And there's, loosen the jar, tighten the jar. And now we do it again. And we see dancing crystals. And now we look at our, and we have a good abrasion. That means that there's something down in the jar that has worked its way over to that orifice. If the jar is real low, then we can just unscrew it and pour it in the trash and throw that away and put new crystals in and the machine is fixed. But suppose the jar is half or 3/4 full of crystals. That's a lot of treatments to throw away. So therefore, what we do is, every time a person comes in for a treatment, we take the jar, stir the crystals, tighten it back up, and do the treatment. We've stirred that, whatever's in the jar, away from the orifice, and you only use about a tablespoon of crystals for a treatment. Therefore, the chances are you're going to do the whole treatment, and you tell the person you're working on, if you don't feel the stinging of the crystals, tell me. And they say, you're halfway through the treatment, and they say, I don't feel the sting anymore. You just grab the jar, stir it again, and continue. As soon as you've worked through that until you can see the lower loop of the venturi pipe, when you work through that jar down to that point, now just unscrew it and throw it in it, dump it in a trash can, wash the jar, put it back on, fill it up with clean crystals, and you're ready to go. You got rid of the trash. How did that trash get into the jar? The trash got into the jar because every time you add crystals, you add it through a funnel. You're working in a beauty salon. You've got little pieces of hair on you. It falls off your smock into the funnel and falls into the jar. So if you don't want that problem to happen, then every 4 months, 3 months, whatever, when the jar gets very low, instead of filling the jar, take it off and pour the crystals in the trash, put the jar back on, and then put new crystals. And if you purge your trash out of that jar, you'll never have a crystal problem. And that's most of the problems you'll ever have with this machine, is debris getting into your crystal jar.
Now, what if I've done all of this and I still cannot get any crystal flow? That there's actually something stuck in the venturi tube itself.
Let's say that happens. The first thing you want to do is disconnect right here and take this hose off. Okay? Take this hose off, because something could have got into that venturi and came through and went up here and is actually stuck inside of here at the base of the accelerator. So you disconnect this, you take this out of the, you take the accelerator out, you put the cap back on, and now when you occlude this, you're going to be drawing air from here instead of here. Okay? And you got it on full, and you just draw air, and you can hear the air whistling right in there. And so the air now goes through, and anything that was caught below the accelerator will be flushed out of there, and it will go into the waste system.
I see.
Okay?
I see.
And then you take this and you look through it, and you can see there's nothing in it, so you put it back in. Okay? Now, was there something in the nozzle below the accelerator? We don't know, but we know that there's nothing there now.
And if it fixes the problem, it's probably been cleared.
That's right. And so now we put the cap back on, and we look and see if we get an abrasion. And lo and behold, we did. So something was in there. What was it? We don't know. It's now in the waste canister. Okay, so, and that happens periodically. So trash can get in here, and sometimes it's a little piece of hair, maybe as long as 1 inch or 2 inches. And it'll fit, and it'll get started into that venturi pipe, and it'll slowly get sucked in and brought right up here and turn into a little ball of hair underneath the accelerator. And then the crystals come up and push that little ball of hair into the lead of the accelerator, and the air will go through, but the crystals won't because of the hair. So that is a problem, and so you have to know how to clear that. Okay, so you can see that this is just the thought process. First you make sure this is good, and then you make sure you have airflow. And if you don't have any airflow, then that means that something else is plugged up, and it could be here or inside here, inside the main body. So then pull this out. Okay, this is your plug.
You have to turn it off.
No, you don't. No. Okay, and now when you occlude the handset, if you get crystal flow and you get the correct reading, and that means that something in here or here is the plug up. Because if no air can flow, then you're not going to get any crystal. And if something's plugged up in here, then no air can flow. The plug is in. So if you take the plug out, now air can get in here, and now we know that from here to here is good. So the next step would be to put this back in and take this out to trace down where this problem is. So we'll take the primary filter off and the primary filter out, and now we'll see if we get airflow. And if we do get airflow, it means that this is plugged up. The primary air filter is plugged.
So you just take one thing off at a time to isolate the problem.
That's right. And the machine isn't that complicated, it's just a little confusing. Okay? So troubleshooting the machine is to understand how it works. This side must have the right pressures and airflow before any of this side will work. This side is a duplication of this side except for the venturi pipe and the aeration pipe. That's the only big difference. Is this side filters out all the trash, this side puts the crystals in. This takes the crystals out, this puts the crystals in. That's the difference. Okay?
I noticed that when you put your handset in the scabbard, that you always put it in with the handset cap up. Is there some significance to that?
Yeah, it's easier on the hoses, and also if you put a new cap on here and you hang it this way, you rub the side of the machine, which contaminates the cap. So I'm in the habit of hanging it up like that. It's better for the hoses. If you put it this way, the hoses can get a kink in them. So I made this scabbard so that you can set the handset in it, and therefore it's not being contaminated. That's the only reason that's like that.
Okay, well, and if I have any further questions, I can call you.
Always you can call the factory. The factory is always available to all the people that have our machines at any time for any questions.
And that's during normal business hours in California?
In California. Normal business hours. 9 to 5.
Okay, well, thank you, Al.
No problem.